Sunil Kini. I'm a ward representative in Embakasi, Nairobi. I'm aged 61 years, around 21 years ago, of which I had an accident. I've been living on painkillers and medicine. The pain on my pelvic and my hip and my lower back. All this time I've been seeing so many doctors, but the only thing they've been doing to me is giving me medicine, painkillers, of which after taking painkillers for so long, they've started having effects on my body, that is side effects. So they reached a point where the pain was so much unbearable, and I had to ask for maybe what I should do to get over that pain, because I would not live all my life on painkillers. After my hip brought problems, it affected my knees, both my knees. So I had pains in the knees, pains in the joints, pains in my lower part of the body. That's when the name of looking for hospitals came. As a family, we sat down and we thought of going to the website and to look for specialized treatment. Whereas that's where the name of Manipal came in. And we found out that in Manipal, we had specialized doctors. So I wanted to go somewhere where I'll have everything in one roof. That's how me and my family we settled for Manipal. When I came to Manipal, everything has gone very softly.
I first saw Mr. Paul Kigawati, 61-year-old gentleman from Kenya, a month back in my clinic. He works as an elected representative of the Kenyan government. He first saw with me with increasing complaints of right hip pain. To give you a brief history, he had a road traffic accident in the early 1980s where he sustained considerable damage to his right hip joint. Soon after that, he started developing pain in the right hip, which increased over the past couple of decades to this degree that he could hardly walk a couple of steps without pain. To make matters worse, he also had a condition called gout, which affects the joints because of a high uric acid content level in him. So he also had pain in both the knees, which started from the past decade, which was also troubling him. So I evaluated him, examined him, did x-rays and found that he had got advanced arthritis of his right hip and arthritis of both his knee joints. After optimizing him and all the necessary tests were done, we counseled him that he needs a hip replacement of the right side and also knee replacement of both the sides. So we went ahead with the hip replacement. The surgery went well, which was followed by a week later by both his knees which were replaced. So patients started walking soon after this first hip was replaced and subsequently after the knee replacement was done as well. So today he's 3 weeks down the line and he's walking considerably well with minimal aid. So these kind of joint replacements, hip and knee, are a very successful surgery, and with the advent of modern bearings and implants, they are they can easily last for more than a couple of decades if taken care of well. So we at Manipal hospitals are an esteemed center for these kind of joint replacements because of our infrastructure and because of the backup.
It's a place where I would like even to refer other people to. It's only 3 weeks and I've started doing my physiotherapy. I'm standing, I can walk a bit, and I'm feeling in the next maybe 1-2 months I'll be well completely. So one thing, it's many thanks to Dr. Sunil. I found Dr. Sunil and the doctors all the doctors who accompanied me were very cooperative.